Hello, Dr. Alberto Cadena. Talking about Botox today. I had forgotten to put a pre-Botox video together on Veronica, but we just remembered today she started recovering some of the muscle activity in her face, and so we applied some Botox yesterday. So today you'll kind of be able to see that it's not really noticeable the day after you have Botox application. The day of, sometimes you get a little redness and little bumps on the areas of the injections. But today is the day after we applied the Botox to Veronica's face. Now, Botox is preventative, so if you use it early enough, when you start kind of seeing the fine little wrinkles that start forming, it'll prevent the deep wrinkles that will come with time. And it's also therapeutic. You know, it treats the wrinkles within 14 days. At 14 days, you'll have the maximum effect of the Botox. Now, if you wait too long and you let the wrinkle get too deep, then when you do the Botox, you'll still have a wrinkle left over, and you're going to have to do something more aggressive to remodel the collagen and try to get rid of the deeper wrinkles. So really the best is to start using Botox at any age, but definitely when you start seeing the fine lines that are forming, that's a warning that you probably should start considering it. So it's really cool stuff. Usually doesn't really hurt at all. And in 14 days, you see this dramatic difference in the skin and the wrinkles. You really notices a difference. The way we do it, we like to keep you the same, not make a dramatic difference, but basically your same look minus the wrinkles, okay? So I'm gonna show you Veronica's face now, and again, this is day one after the Botox treatment, okay? So here's Veronica. She's got a little blemish on her forehead, but as you can see, there are no injection spots and there are no raised areas. Everything looks pretty natural and normal the day after we have applied her Botox, okay? So we're going to demonstrate the frontalis, two big bellies that run on each side of your forehead that raises the skin of the forehead towards the ceiling, and it gives you kind of your kind of worry lines. Go up, real high, good. So those horizontal lines is what we're talking about. Veronica, you can see them, but usually it's worse than that. She still has some effect from the Botox, and we applied some yesterday. Relax. And so in 14 days, the post video we've already done, and you can see the difference, but we're going to demonstrate again the frontalis. Go up. Good. So what we do is we put a series of shots coming across this muscle, and it flattens out that skin. Relax. So you can see little fine lines that develop. Go up again. Down. And that's just from the, over time, the wrinkling of the skin. And so you really want to prevent that so that when you're older, you don't have these permanent wrinkle lines. So that's one of the more common areas that we treat. The next one is the frown lines or the scowl. Show, good. So you see there, right on each kind of the corners of the eyebrow. Relax. And so there are two muscles there that we address. This middle muscle right here is called procerus. And then another muscle that comes around here and goes into the middle is called the corrugator on each side. Some people will try to get by and just inject here, but the dispersion of Botox shot is about 1.5 centimeters. So it's kind of like the size of my thumb. So when we put this here, you can see that it only covers a certain distance, so that's why you have to place a series of shots to cover get good effect on the muscle. Here in the middle, if we were to just put one in the middle, frown again. You can see that her frown lines are just at the edge of the thumb, and it's not going to probably address those, okay? So if we had a big line here in the middle, it might take care of it, but the best thing is to address this area all the way across, kind of up to the level of the pupil right here to get procerus and the corrugator right here, okay? Relax. So that's the frown lines, okay? And then other area that's commonly addressed are the famous crow's feet. That muscle is orbicularis oris, and she's real big, real big, real big, real big. Okay, so you see these lines here and right here. They're usually worse than that, but she still has some Botox effect. Relax. And so we address this area through here, and it takes care of these lines. Small. Good. Okay, and we're going to show the other side as well. Good job. This side's a little stronger. So from around here all the way around here, we address those lines. Relax. Okay. So just wanted to kind of demonstrate a pre-Botox application. We did apply it yesterday, but it gave me the idea of showing how really unnoticeable the injections are the day after we've done them. So any questions or anything you'd like us to address, just feel free to comment below. And again, thanks for watching, and we'll see you until the next video. Thanks.